This is The Road Out, Understanding Addiction and Recovery for You and Your Loved One, with Dr. Margaret Bauman, Medical Director, Psychiatry and Addiction Medicine at Cottage Health, San Luis Obispo Outpatient Program, and Dr. Paul Erickson, Medical Director, Psychiatry and Addiction Medicine at Cottage Health. So we want to talk about today how to know if a loved one or you have an alcohol or drug problem. I think the first question that has to be asked is exactly how much drinking is normal.
So there's no absolute answer to that. There are general guidelines that for men, 3 to 4 drinks at a time or 14 drinks per week is considered the limit for a normal range of drinking. For women, it's a little bit less. But really, it depends on how drinking affects someone.
Okay, so it's different for men and women.
It is different for men and women, yes.
For women, it's usually about half that amount.
So how much drinking is too much then, above the 14?
Well, too much drinking is when drinking affects a person's life in a problem way. That's really what too much drinking is.
You sort of look at, is your drinking, at least the way I look at it, 5 different areas. Is your drinking affecting your work? Are you having legal problems because of your drinking or substance use? Is it affecting your health? Is it affecting your relationships? And is it affecting you socially, meaning, I don't know, your friends suddenly don't want you to come to their parties anymore because you get hammered every time.
So it's really problem consequences because of your drinking. And these are problems that the person who is drinking may or may not see. Sometimes it's the people in their life who see them more clearly.
Are there different personalities? Are there more that can accept it better than others?
People have different tolerances for alcohol. People who have a high tolerance for alcohol, who can drink a great deal without being affected, are actually at more risk for developing problems. People who come from a family where there's a history of drinking problems or addiction problems are at higher risk for problems. But I wouldn't say that there's a personality type that is more at risk. What do you think, Margaret?
Well, and I think you may be referring to what people call an addictive personality. But that's sort of a secondary thing, if you will. The addiction is the primary illness. But certainly someone who has an addiction can also show that same type of behavior with a variety of other things. Gambling, sometimes they can change it over to something that's a little more healthy for them, like they can become addicted to over-exercising.
So what about marijuana? It's legal, but...
Well, alcohol is legal, and it certainly leads to addiction. There are various prescription medications that may be legally prescribed, but you can become addicted to them. So it's the same thing with marijuana. If your use of that drug, legal or not, if your use of that is affecting one of those areas of your life, then that's an addiction.
Sometimes people think that marijuana really is a benign substance and won't lead to addiction problems. But for people who are vulnerable to developing an addiction problem, it certainly can lead to a problem. And particularly for younger individuals.
Oh, yes,
teens
yeah.
and young adults can develop problems.
What behaviors indicate a person may have a drug or alcohol use problem?
Well, sometimes you'll see that it's certainly affecting their performance at work, perhaps, or their relationships and how they behave or act in a variety of relationships, whether or not they may be more irritable, let's say, than they normally were, or if they seem to be more depressed or more withdrawn.
Sometimes it's something dramatic that draws attention to a problem. So somebody will get a DUI because they're drinking too much, or they'll develop a significant health problem. And other times it's more subtle, as Margaret's saying, where somebody in a marriage is very unhappy because somebody's drinking every night and they're really not emotionally available.
Right.
And that's become a problem in the
Right,
marriage.
right.
What if the person denies they have a problem? What do you do then?
Not uncommon
Yeah,
for someone
very
to
common,
deny that they
very
have a
common,
problem.
actually.
Often people around somebody with a substance use disorder see it more clearly than the person themselves. So it's a process often of talking with somebody and helping them to develop the perspective that they do have a problem.
That is a very difficult area because, as Dr. Erickson was saying, a lot of people are in denial, say, about it, and it may take hearing that same thing, you have a problem, with drugs or with alcohol from several different people. Or it may take something, as you're saying, dramatic, getting fired, for example, or getting a DUI.
We've been talking The Road Out, Understanding Addiction and Recovery for You and Your Loved One with Dr. Margaret Bauman, Medical Director, Psychiatry and Addiction Medicine, Cottage Health, San Luis Obispo Outpatient Program, and Dr. Paul Erickson, Medical Director, Psychiatry and Addiction Medicine at Cottage Health. If you'd like to listen to this again or share with a friend, visit cottagehealth.org/The Road Out. That's cottagehealth.org/The Road Out.